Let's talk about psoriasis and psoriatic arthritis, two fairly common conditions that afflict millions of people in the United States. Psoriasis affects approximately 7.5 million Americans. It actually may affect more. I think there are many people who are underdiagnosed or undiagnosed, especially people with extremely mild psoriasis. This is a common chronic inflammatory skin condition, but as we'll talk about later, it's really a condition that's inflammation of the entire body, as many organs besides the skin can be involved. In a nutshell, psoriasis involves immune dysregulation. It's an immunologic condition that is present in people with a genetic predisposition. Though there's almost certainly an environmental influence. In other words, while you may be born with the predisposition, something must come along during your lifetime that sets it off, starts the engine of the car. Unfortunately, the car becomes hot-wired, and psoriasis becomes a perpetual problem for most people who have the condition. Plaque psoriasis is the most common form of psoriasis, but there are also other less common manifestations of this condition. For example, there's something called guttate psoriasis that involves, instead of large red plaques, small little papules that are symmetrically distributed on the trunk, back and front, maybe the extremities. And generally after an acute infection, for example, a streptococcal pharyngitis, a strep throat. There's pustular psoriasis that involves numerous studded red papules with pus-filled pimples on top. People often see this condition as a very extreme form of psoriasis that might be harder to treat. Non-dermatologists often misdiagnose this type of psoriasis as infection, and patients are admitted to hospitals and treated with antibiotics unnecessarily. Inverse psoriasis involves psoriasis of the skin folds, for example, under the arms or in the private area, under the breasts. Usually psoriasis, when it's inverse, is very red but not as scaly. And then there's erythrodermic psoriasis, where the entire body surface area, for the most part, is covered with a very red, shiny rash, much less scale. And actually the patient can feel severe pain and itch. This is probably the most severe form of psoriasis. But nevertheless, we have good therapies to treat it. Now, I don't want to go too in-depth about what causes psoriasis inside the body, but you should know it's a disease of the immune system, as I said earlier, that involves the immune cells, specifically T cells, and what are called dendritic cells within the skin, being overly active. These are the same cells that allow you and everyone else to fight infections. But it's as if in people with psoriasis, the immune system is turned on and inappropriately kept on. In other words, in normal patients who don't have psoriasis, when you fight an infection and you clear the infection, you turn off the immune system appropriately. People with psoriasis have an immune system that doesn't shut off. When you look at the skin under the microscope in a person with psoriasis, you often see very thick skin. The top layer, the epidermis, is thick. There are a lot of blood vessels, which give it a red appearance. And there's a thickened layer of the surface that causes scale. So everything about a psoriatic plaque that you know by looking at it, scaly, red, and thick, we see under the microscope. And this is all caused by the immune system being overly active. Psoriatic arthritis is a condition that is associated with a large minority of psoriasis patients. Approximately 10 to 30% of people with psoriasis especially more severe psoriasis of the skin, have an associated arthritis. This involves stiffness, pain, swelling, and tenderness of a variety of joints. They could be in the fingers or the ankles, the knee, the lower back, and also the inflammation can affect the ligaments and tendons, such that people have conditions like carpal tunnel syndrome, plantar fasciitis, Achilles tendonitis, golf elbow. Early recognition of this condition is important because, unlike psoriasis of the skin, the damage of psoriatic arthritis can be progressive and permanent. Now, one thing about the flares of psoriatic arthritis, they don't have to occur on both sides of the body at the same time. In fact, psoriatic arthritis can affect solely one joint, one side of the body, at any given moment. In more severe forms, though, both sides of the body can be affected. For example, both of the hands could be affected very negatively, or both of the ankles, both of the knees. Important point also is that usually people have psoriasis of the skin long before they ever get the arthritis, such that the skin disease precedes arthritis by an average 10 years. There are patients, probably 10 to 15%, where the arthritis appears first and then the skin gets affected later. And those are tougher to diagnose because obviously the presence of skin disease allows us to know this is a psoriatic arthritis and not another type of arthritis. And depending on when the condition or which condition appears first, the patient goes to the respective physician of that specialty. For example, if it's more of a skin issue, dermatologists see this patient first. If it's more of a joints issue, the rheumatologist sees the patient. Like I said earlier, most patients present with the skin first, maybe 75%. And therefore, it's the dermatologist that's often in the position to first identify and appropriately treat or refer the patient who has psoriatic arthritis as well. There are other signs and symptoms you should know about in a person who has psoriatic arthritis. For example, lower back pain or neck pain and stiffness, especially worse in the morning. This is a condition that's worse after inactivity. So not only after waking up, but also, for example, driving your car for a long period of time. Getting out of the car seat, the same symptoms arise, stiffness in various joints. Fatigue is an issue in people with more severe psoriatic arthritis. People have reduced range of motion in their joints. Their fingers and their toes may be swollen, like they appear like sausages. We call those sausage digits. There could be redness in one eye. We call that a uveitis. And that is not common, but if you have associated eye inflammation and you have psoriasis and psoriatic arthritis, you are not uncommon, and there are specific therapies for those conditions in combination with each other. Finally, abnormal nails like pitting or ridging or thickened, crumbly nails. That's all part of psoriasis.